And welcome to anatomy class. Today we are going to learn about the soleus. You're going to learn the origin, the insertion, the actions, nerve innervation, and arterial supply. Stay tuned to figure it all out. Right here is your soleus. We can see it's a big old flat muscle behind your gastrocnemius. It's going to be the origins back of your fibula right here, the posterior aspect of the proximal end of the fibula to be exact. There's another origin right here on the back of your tibia, right here. This is the soleal line of the tibia. So we can see those two are going to be the origin. Remember, the origin is the one that least moves. The insertion is going to move the most. So right here and right here are going to be your origins. So the posterior aspect of the proximal end of your fibula. This is your fibula bone. This is your tibia bone. And this is the soleal line of your tibia. Let's see what it looks like just with the soleus right here. We're going to check that out. Zoom on in. Come on in there, feller. Come on in. So we can see origin is going to be on that soleal line of your tibia, posterior aspect of your fibula right here. We can see that's going to originate right there. Now the insertion is going to be, let's go back to that. It's going to be on your calcaneus via the Achilles tendon. This is going to call it something else, but we know that is the Achilles tendon that comes down with your gastrocnemius. So it kind of attaches with your gastrocnemius. That's what this area right there is going to be. Let's go up a muscle. And we can see those kind of blend together right here where they create your Achilles tendon right here. And it inserts. So the insertion is going to be on your calcaneus. This is your calcaneus bone right here. So origin is going to be up there on your fibula and your tibia. Insertion is going to be down here on your calcaneus. Now, knowing that the insertion is on your calcaneus, let's look at the motion that it's going to do. So it's not going to, since it doesn't cross this knee joint, it's not going to bend the knee at all. It's not going to do any of that. It's going to do plantar flexion via the Achilles tendon. So we can see that the concentric movement of this right here is the insertion pulling towards the origin right here. So right there, because that's your gastrocnemius. Origin right there, insertion right here, shortening towards your origin. And this is going to be plantar flexion. Now, the Latin word for soleus is sole, meaning sandal. I don't know why they would name it that, but they did. It's Latin. That's what they do. The soleus is a vital muscle in walking because it has a higher number of slow twitch muscle fibers, up to 60 to 100%, depending upon the person. So it's going to be able to last longer than your gastrocnemius in walking. We can see that right here because this one crosses the knee. Another fact is the soleus is a super important muscle for standing. Now, if it wasn't for the soleus and its constant pull, you would actually just fall forward. Crazy, right? Such a little guy, and he's so important. I bet he doesn't even know that he's that important, but he is. Also, in the upright posture, the soleus, this little fella right here, such an important muscle, is responsible for pumping venous blood back to the heart, pumping it from your peripherals, so all the way down here, back up. And it's also called the skeletal muscle pump. Interesting. Pretty fun fact for you. The soleus is actually the best muscle for plantar flexion in the knee bent position. As we see, the gastrocnemius here crosses this joint. So it attaches to your femur, where if you're bent in the, so let's think about knee flexion, where this is bent, and you're able to do more plantar flexion with your soleus than you would your gastroc, because in the bent position, this is on slack. Your gastrocnemius is going to be more on slack than your soleus. It still has that tension because it attaches to your fibula and your tibia right here, as we can see this feller. Another cool fact about the soleus is during walking, it is the primary muscle because, like I said, it's got 60 to 100% slow twitch muscles. So it's going to wear out a lot less than your gastrocnemius. So this is one of your primary walking muscles doing plantar flexion. This is the nerve that is going to innervate your soleus. It's the tibial nerve. It goes from L4, L5 and S1, S2. This one is only going to show the S1, S2 really, but the L4, L5 also come out right there for your tibial nerve. If we look in the information, we can see that they only listed the S1, S2, but we know that we are smarter than the average person, and we can look at a highlighted path and say, hey, where are those little fellas? Well, that's your L4, L5 and your S1, S2 down here. Comes down, innervates your soleus all the way down. This is your tibial nerve. We can see that it is going to be anterior right there. Pretty cool little thing. So that is going to be the nerve that innervates it, L4, L5, S1, S2, as we can see right here. So let's talk about the arterial supply. We have the posterior tibial artery, we have the popliteal artery, and the fibular artery. As we can see, we're going to highlight all of those right here. We zoom in. This is where that arterial supply is going to be. If we look on the left-hand side, this is the entire supply path. So all these little fellas, and let's isolate it right here. We can see right here all the way up, and that's going to go all the way up to that beautiful little heart right here. So remember, posterior tibial artery, the popliteal artery, and your fibular artery. That is going to be your arterial supply for the soleus. For testing your soleus, the soleus can't really be tested in isolation. So you have to test doing plantar flexion with all three muscles that form your triceps sorae. When you want to test plantar flex, you might be able to feel it a little bit more in when you have knee flexion. So when your knee is a little bit more bent, give it a try. Hey, y'all, thanks for watching the video. If you enjoyed what you saw, throw me a like down there. Leave me a comment if you have more questions. And subscribe. Helps me out, or don't. It's up to you. Free information. See you next time.